Okay, welcome everybody. I'm Walter Proper. I'm the Executive Director for International Association of Public Health Logisticians. And this is a webinar as the second in a series on impact teams. And this one is concentrating on learning packages. The earlier one, which is on our website, it was about the design and implementation. And so we're, go to the second one. Next, yeah. So just briefly, again, the impact team, information mobilized for performance analysis and continuous transformation. So again, you can see the previous webinar. If you want to catch up, this one also will be recorded and put on our website. And without further ado, let me introduce our panelists. So we have Juma, who is a highly dedicated, motivated public health supply chain pharmacist with more than 11 years working in health systems. Before joining In Supply, the organization he works for now, he worked at JSI and in supply chain management systems and global health supply chain projects. He has supported roles in supply chain initiatives in Tanzania. His areas of expertise include health system strengthening, as you can see there, design, implementation, and of course now impact teams. He's worked in human-centered design as part of that and in various supply chain initiatives. He holds a bachelor's degree of pharmacy from Muhimbili University of Health and Allied Services and a master's degree in business administration from Muzumbi University. And then his colleague is Joseph Dow, who, as you can see, big on data, part of his title. He has experience working in national and subnational levels with healthcare workers, and really to bring data to the forefront of decision-making. He's worked in health system building blocks, reinforcing foundations for efficient, equitable healthcare systems, and a very proactive health champion with outstanding public health relations and communication and presentation, which we'll see soon, and interpersonal skills. Okay, so welcome and thank you, the panelists. If we can go to the next, if you have questions, please do use the Q&A function. I'll be monitoring it as we go along, and when we end, we'll try to answer all your questions. As it says, if time permits, if it doesn't, we will answer them and follow up with on the listserv for IPHL so that all questions will be eventually answered. Okay. So I think I'm gonna go ahead and start with Juma, and just first say, Juma, could you say something more about In Supply?
Okay, thank you, Walter. In Supply Health, which is an affiliate of JSI, is an independent supply chain and advisory firm based in East Africa that provides customized guidance on supply chain management and design. Our solutions focus on optimizing data visibility and use, workforce development, and continuous performance improvement. Usually, we are passionate and radically practical about technology and innovations, quickly navigating the landscape and adapting solutions for the local context with a view of efficiency, scale, and sustainability. We do work across public as well as private sector and partner closely with our customers, including the ministries of health and other stakeholders at all levels, using human-centered design and adaptive learning approach to better understand their needs and co-create solutions together. Thank you.
Thank you, Juma. So we're going to stay with Juma and go to the first question, which is, what are learning packages?
Learning packages were tailor-made to act as self-paced online modular courses focusing on building competence to improve supply chains. Normally hosted on the Impact Team portal and can be accessed by anyone who is registered at any time and place. The targeted groups are the impact teams, but also the data review teams and commodity management teams. But of recent, we have found them very usefully to other individuals from other categories, including me and you. And the main focus is to build capacity within the teams to improve health supply chains by optimizing their tasks through data review and use for decision making, problem solving, and action planning. There are a few things which one required prior to accessing the learning packages, and these include first of all, you need to have the working gadgets such as a computer, laptop, a tablet, or any kind of smartphone, of course, which is connected to working internet. You also need access credentials, which acts as your identifier, which is provided after being registered. And whenever you need some sort of assistance, then orientation videos are available in the portal, but also an experienced user can orient a new user, but also we as InSupply do provide orientation before you begin uptaking the packages.
Thanks. So let's go for this next question to Joseph. And so how were these learning packages developed?
Thank you, Walter. So from our human-centered design research, we were able to develop the 7 personas through reflection from impact team composition, where we identified ideal competencies and behaviors required from each persona. Then this was followed up by self-assessments in the form of a role profile, which led us to identify gaps and potential learning opportunities. So this was then followed up with designing and developing a curriculum from these findings. And we designed these learning objectives by consulting experts and combed over literature reviews to develop the course content. And then it was then subsequently beta tested by gathering feedback from field experts and impact team members, where we were able to get the learning packages to where it is currently. Next.
Yeah, Joseph, can you talk a little bit more about these 7 personas?
Yes, so the 7 personas of an impact team can be mainly categorized into 2. That is core and enabling members. So starting with the core members, in a nutshell, they are vital for an effective impact team to function in day-to-day activities. And starting with organizing Otto, this is someone who calls meetings and ensures logistics are in place and creates agendas and takes notes. So people expect to hear from him about how work is delegated. Peter Problem Solver, on the other hand, is always constantly questioning, but why? When it comes to challenges, he is good at thinking and steering the team towards actionable and practical next steps. Looking at data with Diana, she is someone who understands the indicators and can interpret data to non-data people. She's familiar with supply chain data sources and can analyze raw data from spreadsheets and graph trends. So supply chain Sam, finally, is someone who has a very deep understanding of the supply chain processes, and when challenges are identified, can critically analyze and suggest supply chain specific solutions. Moving over to now the enabling and support members. And in a nutshell, again, these are those members who might not attend all meetings, but are vital to getting things done. And currently, we have developed modular courses for the core members and the enabling core members, and the enabling and support members are still in the pipeline. But looking at influencing Irene is someone who has very strong relationships with and easy access to key decision makers. Her inputs hold weight, and when she suggests actions, is taken very seriously. Resource Rita, on the other hand, influences the purse strings, and she knows where the money is available and knows how to advocate for it and how to present it in a way that can be approved. And finally, Lucy leader, she holds authority. Everyone knows that if she doesn't endorse or support the meeting, it doesn't happen as planned. She has the big picture view in activities and is able to leverage or to carry out these solutions. Thank you.
Thanks. I think IPHL needs another resource Rita to help us get resources. So the next question, let's go to Juma on this one. What is the IMAPCT team support package tool?
Yes, and this is specifically happening in Tanzania, whereby another tool called the Impact Team Support Package is usually used to document all supply chain and impact team processes challenges, which need to be solved by a particular impact team. It also documents the proposed solutions or interventions which a team need to take, including all the associated activities and tasks. Normally, team members will fill the tool as a team guided by an experienced facilitator, and if possible, a representative from the supervisory levels or stakeholders, if available, such as implementing partner, can participate in the filling process. And once the tool is filled, it can be shared to stakeholders, especially targeting those who will be involved in the process of implementing the action items. The tool also provides an option to the team to focus on which problems based on the impact, urgency, and availability of resources. So the team can choose which problem to focus with first. It also suggests if a challenge can be resolved from within the team or it needs support externally. It also states when a particular problem can be solved, and if a skill is needed, or if the skill gap is observed, can it be addressed by just the learning packages, or it needs any sort of training like the classroom training or any mode of capacity building. And lastly, it can be used as a reference tool for learning successes and failures. And of course, it focuses on challenges facing the team on various aspects. Thank you.
Oh, interesting. And again, that importance of the people themselves working and making decisions on what they need, if they need training or where that group needs to go. I think we'll stay with Juma and maybe answer, what are the benefits do the Impact Team learning packages offer over other modes of learning?
Yes, first of all, the packages can be accessed online and are free. You only need to have access credentials to access the materials. The packages are targeted to address challenges identified during the Impact Team self-assessment exercise. Hence, there is a high chance of solving issues which are very critical to supply chain performance. And the package is also best suited to Impact Team members who always are very busy and their schedules are very tight. So these members can decide on their own when is the best time to take them. It can be in the morning, afternoon, or even night, depending on the time available. And also the learning can be applied on a wide range, not only in solving Impact Team related challenges, but also other challenges which we encounter at workplace. Yep.
Okay, so let's go to Joseph for the next one. And how widely have these learning packages been used?
So currently, we have implemented the learning packages in both Kenya and Tanzania. So far as we have developed course content for the core personas, while the enabling support is still in the pipeline. That's why, as the table shows, we're showing the 4 core personas. In terms of uptake, we're tracking that through certification. So far, we have a total of 172 certified users. And then in order to be certified, users are required to complete a final knowledge check at the end of the modular course. And this is attained after attaining at least 80% with the knowledge check.
Okay, and so maybe go to Jima. So for our next question, so you've got these packages, you're busy people, as you've mentioned. So what have you done to motivate people to use this tool?
Yes, people need to be motivated, especially the impact team members who are very busy to uptake the learning packages. So to accelerate the uptake of the packages, we normally provide the access credentials. So whenever we receive a request, then we create and share the credentials as quick as possible to interested learners. And sometimes we deploy or we use social forums to fast track communication between we and the users. And also we do share user experiences from the pioneers on how they have found or on what benefit have they got after uptaking the learning packages, and how the package have helped them to solve their challenges. Another approach is to use inspiration from impact team leaders. We have a good examples, and one of it happened in Siaya County in Kenya, whereby an impact team leader was among the frontliners in uptaking the package. So members, after seeing that their leader is doing so, they were highly motivated and eventually making the count one of the leading by a very big margin when it comes to the learning package uptake. And other approaches which we use or some teams use is to create internal competitions. For example, we had a good example from the impact team members from Sikonge district, which is in Tabora region in Tanzania, who are competing on who becomes first to complete the learning package and be certified. So creating some sort of competition speeds up the uptaking process of the learning packaging. And recognition also do works whereby impact team members who have been completed and certified are being recognized using a number of forms, like nominating them in forums, issuing certificates, and this encourages others to follow the footsteps. Thank you.
Great. So we'll stay with Jima. So you've got these people motivated. They've now done the training. They've come together. So I guess the big question for people is how they have applied this knowledge that they've gained from these packages.
Yes, Walter, the knowledge and skills gained from the learning packages have been widely applied, especially to solve some supply chain challenges and start improving the performance on some indicators like commodity availability and data quality. Also, some impact team process indicators such as organizing meeting and conducting them as per schedule have improved, and hence the dependence on one impact team member to coordinate meeting or dependence on in-supply to coordinate impact team meeting has eventually reduced. And also some members have applied the learnings from the learning packages in other activities, which are normally or to solve challenges encountered at workplace other than impacted teams. Thank you.
That's great. I like the fact they're helping manage their church better. So to Joseph, you know, the big question is, how will you ensure sustainability?
So we have come up with a few post-project strategies, and we have developed short and simple informational videos on one of them is like a quick introduction to the learning packages and a how-to video on accessing and navigating through the IT portal. And then another is just incorporating the learning packages into the impact team manual. And finally, we are planning to sync with local professional associations to offer CPD points once users have completed the course. So it gives back to them.
What are CPD points?
CPD points, those are professional points which you can earn for usually pharmaceutical. Like if it's a pharmacy, they can earn to their profession.
Profession, yeah, certified. Okay. And so how do people assess these packages?
So to access the learning packages, first and foremost, you need an internet connection, basic internet connection. And then in terms of a platform, it's very, very inclusive. So that is a laptop or a tablet phone is very much manageable. And then the URL or link to it. And just something to note is that the videos which I've already alluded to are already embedded on the landing page. So it will be easy to just access it. And then finally, login credentials, which we as in Supply Health will provide.
Great, excellent. So let's go to, okay, that's just, again, how you can do it, how you can get a hold of it. I think there's one question in the question box. How do you handle items that were not brought to the warehouse physically, but to the end user directly, but only document of the supply that was brought to the warehouse? This is a very specific supply chain question. So do one of you want to try to answer this one? Juma?
Walter, I can try and using the Tanzanian context. We have a number of channels where the SDPs, the service delivery points, can receive commodities. The first one is from the main supplier, which is the medical stores department, but also facilities when meats from the main supplier are allowed to procure from the prime vendors or the local shops. So in cases when they receive commodities which are not coming from the main supplier, what they require to do is to document them in the store's ledger, and when issuing to clients, they also they're also required to enter them into the registers which capture the consumption. But during reporting, all the incoming commodities from the main supply and those which were purchased from the local shops will be reflected in there. So if the Ministry of Health wants to track the commodities, they can track through the system, the facilities are reporting through the system called the ELMIS, Electronic Management Information System. So all information on the receipts and issues can be captured there. But if they want to verify, they'll have to go to the facility so that they can maybe audit the documents and the available stock or the remaining stock which is available at the physically by visiting the facility.
Thank you, thank you. So there's just a question in the chat was about, can the participants have the video? Now, all our webinars are on the IPHL website. So if you just go to iphl.org, then you can look and see that all our webinars are there. So all the videos, you can see at any time, including the previous one to this one. Okay, I don't see any other questions. So again, if you are not a member of IPHL, you can, you can join for free and join IPHL. Again, we have about 8,000 members. We're in 154 countries. Some of those countries also have country chapters. So the kind of question that was just asked is also a kind of question that someone will ask to the community and get all kinds of answers in addition to Juma's great answer. So I think without any other questions, then I'm going to again thank the panelists and Juma and Joseph. Thank you for your time. And I think this concept of using the human-centered design and having these teams and people who on their own decide what they need to do and how to go about it, and including what kind of learning they need is fantastic. And it is the wave of the future. And the fact that they can learn at any time is just great. So this is the second one. And we probably months from now, we'll do a third one maybe on the final kind of evaluation of how far we've come or they've come. So again, thank you to the audience for also using your valuable time. And thank you for the panelists for giving us their time and to do this webinar. All right, thank you all. Oh, we got another chat. Wait a minute, wait. Ah, okay, just thank yous, and that's great. And thank you again, as it should be, to the panelists for a great job. So thank you all. Bye, everyone.
Thank you. Bye-bye.
Bye.
Thanks and bye.